Are you turning 65 in the near future? Are you wondering if you should start Medicare or stay on your group health insurance policy? Stay tuned. My name is Billy Williams. My phone number is 800-499-1942. Our website is MedicareHealthInsuranceOptions.com. We are an independent agency that specializes in the senior market. We make these videos for individuals who may be looking for important information to help them in the decision process. Our services to you are always free. We ask you to subscribe to our channel. Please like this video, share it with your friends, and also leave any questions or comments that you might have below. This is a question that comes up in our office very often when we are working with individuals who are turning 65 but are still working. Most of these individuals will have an option whether to get both Part A and Part B of Medicare, or to stay on their group insurance plan and only get Part A of Medicare. First, I want to talk a little bit about what happens automatically when you turn 65. If you have worked at least 40 quarters, that's 10 years, with a company that has deducted money from your income and paid into Medicare for you, you will automatically get Part A of Medicare. Part A of Medicare will begin on the first day of the month that you turn 65. This is automatic. There's nothing that you have to do to get it, and there's also nothing that you have to pay. It is free. However, Part A of Medicare will only cover you if you are officially admitted to the hospital. The other part of Medicare is called Part B. Part B of Medicare is any medical care you need that is not a stay in the hospital. This is optional coverage, and there is a cost for Part B of Medicare. If you are already receiving Social Security benefits, you will automatically be signed up for Part B of Medicare. Currently, in the year 2020, most individuals, the monthly cost for Part B of Medicare is $144.50. So if you are already getting Social Security and you have decided that you do want Part B of Medicare, then there is nothing that you need to do. You will automatically be signed up for Part B of Medicare. You should get your Medicare ID card sometime in 2 to 3 months before the month that you turn age 65. If you are already receiving Social Security benefits and you decide that you do not want to get Part B of Medicare, you will need to take some action. You will need to contact Social Security Department and inform them that when you turn 65, you do not want to start getting Part B of Medicare. If you are turning 65 in the near future and you're not getting Social Security yet, and you do want to get Part B of Medicare, then you will need to take some action. It's very easy to sign up for Medicare only. I do have another video that goes into detail on how to sign up for Medicare online. I will include a link to that video in the description of this video below. So at this point, the question to answer is, should you get Part B of Medicare at age 65 if you are still working and have access to a group health insurance plan and may consider staying on your group plan? So one of the questions that you will need to ask your employer at this time is if you are going to be required to get Part B or not. In some cases, when you turn 65, your employer will be willing to continue to provide health insurance to you, but at that point they prefer to be the secondary coverage. In this scenario, you will need to get Part B of Medicare, so that Part A and Part B of Medicare will be your main coverage, and then your group plan will be your secondary. In other cases, your employer may be willing to continue to provide you health insurance that is your primary coverage, and in this situation, you would have your group policy as your primary coverage, and then you would have Part A of Medicare as your secondary. If your employer tells you that they are only willing to be secondary to Medicare, then you will be required to get Medicare Part B. The next thing to consider in this scenario would be if your employer does tell you they are willing to continue to be the primary coverage and you are not required to get Part B of Medicare, should you? Is it better to stay on your group plan, or would it be better for you to leave your group coverage, set it up so that Medicare is your main coverage, and then possibly get a secondary Medicare supplement policy in the open marketplace? This is not always an easy decision. It's difficult to compare the two options. The types of coverage that you're going to have at a place of employment, a typical group health insurance plan, is different than Medicare and a Medicare supplement. In some areas it's better, and in other areas it's not. There are a number of different factors and variables to consider. A few of these are: what is the cost to you to be on your company group plan? How much do you pay every month or every pay period to participate in your group health insurance? On your group plan, in addition to your monthly premium, what is your annual deductible that has to be met first before the insurance plan will begin paying benefits? You also want to be aware if your group plan at work does have any network restrictions that would require you to see specific doctors that are covered under that plan in your area. What is your annual maximum out-of-pocket? What are your co-payments for doctor visits? What are your co-payments for prescription medications? Does your group policy include extra benefits like dental coverage, vision coverage, and so forth? Another important consideration when looking at a group insurance plan at work is sometimes when we're working with individuals, they're turning 65, and if we were only considering their coverage, it's going to be better for them to leave the group, get Medicare, get Part B of Medicare, get a Medicare supplement. However, in many cases, they have one or more dependents that are under the age of 65 and need to continue on the group plan because they don't really have any other affordable health insurance options. In these situations, sometimes we have to wait for the other individual to turn 65 or to find some other coverage that might be affordable to them before we would recommend that anyone leaves or stops their group coverage. In some situations, the employee can leave the group and keep the household dependent on the coverage. Other times that is not possible, so this is another factor to consider in this decision-making process. So what happens if you lose your group coverage, or if you have come to the conclusion that it's really too expensive? The good news is there are going to be other, most likely very good options for you. The first option would be to enroll in Part B of Medicare and do Medicare only. You would have Part A and Part B as your main and only insurance. This is good coverage, but there are a number of gaps, and this is not something that we generally recommend. Another option is to enroll in a Medicare Advantage. A Medicare Advantage policy is either an HMO or a PPO, and it works in some ways similar to a group policy in that it does have co-payments, it does have a network, it does have a maximum annual out-of-pocket. We have another video that we've made that goes into more detail to compare the difference between a Medicare Advantage and a Medicare Supplement policy. I will include a link to this video in the description below. The next option would be to leave your group plan, get Part A and Part B of Medicare as your main coverage, and then to enroll in a secondary plan to your Medicare. These plans are sometimes called Medigap plans, more commonly referred to as Medicare Supplement. A Medicare Supplement policy is relatively easy to understand. It simply is a secondary to your Medicare. If you receive medical care and you have Medicare Part A and B as your main coverage, then you do not have any network. You can go to any medical provider in the United States that accepts Medicare. Medicare pays first. Your secondary Medicare Supplement policy pays second. So between Medicare and your Medicare Supplement, the majority of your healthcare cost will be covered by these two plans working together. If you have Medicare as your main coverage and a Medicare Supplement plan as your secondary coverage, you then also have the option to get a separate Part D prescription drug plan. Some of the benefits of having a Medicare Supplement plan are you do not have any large annual deductible. Most of your medical bills will be covered between Medicare and Medicare Supplement. You do not have any network restrictions. Your annual maximum out-of-pocket, that is the maximum exposure or risk that you will have, which includes your monthly premium and any deductibles that you might have, is a very low number compared to, in most cases, what your maximum out-of-pocket would be on a traditional group health insurance plan. If you do decide or are curious about your options when it comes to choosing a Medicare Supplement policy, that is certainly where an individual like myself could be very helpful to you. This is my specialty. I've been in the Medicare space for over 10 years. If you do decide that you may want to get Medicare and a Medicare Supplement, we would certainly be very happy to help you in this process. We can take a look at your location, the different companies that are providing coverage in your area. We can look at the different plan letters that are available, give you some idea what the cost would be, explain the different benefits of each plan, and come up with an idea which would be the best value for you. We can also help you choose a Part D prescription drug plan, and we can give you step-by-step instructions and help you through all the different steps in this process. I know there's a lot to consider when you're turning 65, but we are here to help you if we can, and I hope that this video has provided some helpful information. We do look forward to speaking with you in the future, and I certainly hope that you are having a great day.